My name is Kristen Robertson, and today I'm going to persuade you to get your dental x-rays done when you go to the dentist. When going to the dentist's office, you may be asked to take a dental x-ray. So the dentist can see what is going on in your mouth, because they have to see what's deep down in your mouth, because if they're just doing physical examination, they can't always see deep inside your teeth. The best thing you can do when you're asked to take a dental x-ray is to actually take the dental x-ray. On one side, a patient may choose not to receive an x-ray based on medical concerns, as if they were pregnant, or if they're concerned with cancer or radiation exposure. But on the other side of the issue, there's a strong need to receive a dental x-ray, so the dentist can see deep inside the patient's teeth. Although there are some risks along with getting these dental x-rays, the greatest risk of all is not taking them. Now let's look at the history of dental x-rays to understand the background information of them to help make a better decision whether you should take a dental x-ray or not. In 1895, Wilhelm Röntgen, a physicist who was intrigued by glowing cathode tubes, decided to experiment with them and see what they could do. After much experimentation, Wilhelm had found that tube emitted rays that could pass through certain objects and leave shadowy images on a fluorescent screen. Wilhelm found that the rays could pass through things such as body parts as well as other solid objects. The bones were seen evidently visible on the fluorescent screen. Wilhelm did not know what was causing this occurrence, and because of this he labeled the rays X, which is the mathematical symbol for anything that is unknown, so that's where we get the name X-rays from. Today scientists know that X-rays are a form of energy that travels in waves. X-rays can enter through solid objects and either absorb or continue to pass through them. The denser the object that the X-rays enter, the more the rays are absorbed and the less they are able to pass through. Now I will talk to you about 5 different kinds of dental X-rays that are used today. The first one is a new method that is used in dental offices. It is called a digital X-ray. Digital X-rays use a small sensor to send pictures to a computer where the pictures are recorded and saved. The second one is a bite-wing X-ray. Bite-wing X-rays are used to show the upper and lower back teeth, as well as showing how the teeth touch each other using only a single view. Bite-wing X-rays are used to check for decay between teeth to show how well the upper teeth line up with the lower teeth, as well as showing bone loss when the dental infection or severe gum disease is actually present. The third one is occlusal X-rays. Occlusal X-rays show the roof of the mouth and are used to find extra teeth that have not yet broken through the skin. Jaw fractures, cleft palate, cysts, abscesses, or growths are also being able to see through with this X-ray. Occlusal X-rays are also used to find foreign objects that are stuck in between the teeth. The next X-ray is called the panoramic X-rays. Panoramic X-rays are used to show a broad view of the sinuses, teeth, jaws, and nasal area, and as well as jaw joints. Panoramic X-rays are not used to find cavities, but do show issues such as impacted teeth, bone abnormalities, tumors, cysts, infections, and fractures. The last one is periapical X-rays. Periapical X-rays show the entire tooth, all the way from the exposed crown to the end of the root to the bone that supports the teeth. Periapical X-rays are used in finding dental issues below the jaw or gum line, such as cysts, tumors, impacted teeth, abscesses, and bone changes linked to some dental diseases. Now I will discuss the risks and benefits associated with not receiving a dental X-ray. The risks are patients who actually go on check to experience more pain and discomfort, even lose more teeth because the proper treatment could not be carried out without the knowledge that the problem exists, which they need X-rays to know that the problem actually exists. The benefits of not receiving a dental X-ray is the increased amount of radiation exposure, which a lot of people are scared that if they do get a dental X-ray that their exposure level will go past the limit and they'll get cancer or something. Now I will discuss the risks and benefits of receiving dental X-rays. The risks are there is a small amount of radiation exposure, but with many different encounters with dental X-ray radiation, then there is a risk. The benefits of dental X-rays help dentists uncover and recognize fairly common dental diseases, such as cavities, infections, and other diseases. Without using the x-rays, the ability to see inside the teeth and underneath the gums would not even exist. Now that you better understand the x-rays, let's review what we have learned today. Today I've explained the need for dental x-rays. I've talked about the history of dental x-rays and where they came from. I've listed and explained the uses of 5 different kinds of dental x-rays. I've explained the risks and benefits of not receiving a dental x-ray, and I've also explained the risks and benefits of receiving a dental x-ray. So the need for dental x-rays is evident. A simple x-ray can reduce dental issues in the long run. Any patient that is concerned with the current state of his or her health should really consider getting a dental x-ray. It's suggested when going to the dentist. Going without a dental x-ray can result in a lifelong struggle with dental diseases and even a loss of teeth. Dental diseases causing a loss of teeth can cause a negative emotional impact on the patient's life as well. When a patient chooses not to get an x-ray, they are choosing to live with possible dental diseases that will alter their life forever, not only physically, but also it will cause an emotional strain. Dentists gain valuable information from the x-rays that they take. It is not in the best patient's interest to refuse a dental x-ray. In the future, patients should be smart and get x-rays. So get x-rays. Thank you. Now is the question and answers portion of my speech. Anybody have a question? Okay, yes?
What is the best dental x-rays?
The best type of dental x-ray is digital because it uses a minimum amount of exposure and less radiation. Plus, they can get it to a certain specific spot easier. Anybody else? Yes?
Can a person get overexposed with radiation after just one dental x-ray?
No. One dental x-ray only uses a small amount of radiation. It'll take quite a few exposure times over a period of a long time in order to have overexposure. Anyone else? Yes.
What are the precautions dentists use when taking x-rays?
They use a limited amount of radiation, and they single out the targeted area, as well as putting a lead vest on the patient. Thank you guys for coming today. And, yeah.